Daniel Weiss here, CEO of BRIA Health Services. You probably recognize me by now in my mask. Here today at BRIA Chicago Heights with Dr. Lance Wallace. Dr. Wallace is our medical director and a trusted health provider who works in the community caring for individuals.
I have been practicing internal medicine in this community for over 25 years. I've treated over 500 patients with COVID-19 so far since March, both inpatient, outpatient, nursing home setting. I recently received my second dose of the Pfizer vaccine approximately 5 days ago. I've done very well with it.
You know, we just walked around with Dr. Wallace. We talked to 10 or 11 staff members, and he was able to talk to them about the vaccine and give them some input. So I'm here now in the clinic with Dr. Wallace and with Tiffany to talk a little bit more about the vaccine and a little bit more about how we stop COVID. So,
one of the biggest questions that I've been asked so far is that people are concerned that it interferes with their DNA, that their own DNA, that they're concerned that how is that COVID vaccine going to affect them?
No aspect of the vaccine interacts with the person's DNA, period. It just carries instructions to tell the cell to make a specific protein. But there's absolutely no interaction with the person's DNA and has no long-term effects on a person's genetic makeup.
Is it a live virus?
No, it's not. It's basically an artificially made template of the COVID-19 DNA. A certain segment of it is copied, put into the mRNA, which is delivered to the cell. There's no infectious aspect to this vaccine at all.
The next big question is, they came up with this so fast. The vaccination scheme has been made within the last 6 months. What is your response to that?
Well, the technology has been under development for over 10 years. They've been looking for a long-acting form of a vaccine across multiple diseases, but they never had to actually apply it. They also had significant financial funding, which made it very easy for them to go to manufacturing right away once it was approved.
In my own research, I've really seen that studies show that African American community has been vastly affected by this virus. What is your take on that and your recommendations for that community, our community, to get vaccinated?
Well, you know, African Americans have significant comorbidities. You know, we have higher rates of diabetes, higher rates of hypertension, you know, lack of screening tests for cancer and this sort of thing. And it puts us at increased risk for complications from the COVID-19 virus. So it's very important for the population that's having, you know, the worst outcomes to get vaccinated, because that'll help to prevent some of these, you know, outcomes. I've seen multiple patients, not only have they been sick from COVID-19, but then they continue to have long-term health problems related to it. So by getting vaccinated and preventing yourself from getting the disease, that will also, you know, result in you having less long-term problems should you become infected. You know, God gave you an immune system, and the immune system needs to be educated because you don't have any natural immunity to this virus. So getting vaccinated is going to give you the best long-term health in case, you know, when you encounter this virus. You're much less likely to develop any type of disease or long-term effects from it. So please strongly consider getting vaccinated.